Good afternoon, everybody. I'm Brianna. I go by she, her pronouns. I will be introducing this panel for today. So welcome to Sexual Health and Healthy Relationships for Royal Young People. I also want to just state that there is a content warning for this panel, as it will have sexuality in it, mental and sexual health, and possibly abuse spoken about throughout the session. So the topic's about we need to support young people to enjoy more ethical, respectful and safer relationships now and in their futures. How can we take a strength-based historical approach to this and build on work already underway? There will be several amazing speakers that I will be glad to listen to today. And then there will be a discussion and a Q&A towards the end. I also want to just state we do not have any interpreters today for this session, but we do have captions and you can put subtitles up on the screen if you need to do so. If you have any questions throughout this session, you can just put them in the chat and they'll get answered towards the end. I would like to introduce Derm Ryan, who is the Royal Manager at YACVic. Derm has been involved in the community development and health promotions and youth work over the last 25 years, in which he has been a part of YACVic for the past 2.5 years, which he has had many roles in. Derm has had a strong record of accomplishments of working in royal and regional communities, both in his YACVic roles and from his time as a Royal Projects Manager for ACON Health in New South Wales and a National Manager of Education and Indigenous Projects for the Australian Federation of AIDS organisations. Derm has a strong commitment to volunteering and has held a number of governance positions on boards of organisations working with a diverse of community, in particular young people. So I would like to pass it over to Derm now. Thank you.
G'day everyone, and welcome to this session, and thanks Brianna for that introduction. I'd like to start by acknowledging that we're all meeting on Aboriginal land today. I'm coming to you from the lands of the Wurundjeri people of the Kulin Nation. I'd like to pay my respects to elders past and present, and also to welcome any Aboriginal people who might be joining us for this session today. My name's Derm Ryan. I use he, him pronouns, and I'm the manager of YACVic Rural and also the moderator for the session. My background is in youth work and also in community sexual health throughout New South Wales and Victoria. Today, we're going to hear from 4 fantastic speakers, Ange Davidson, Jenny Walsh, and also from 2 young people, Kyle Hayes from Macedon and Sienna Gladstone from Warrnambool. The session will have a Q&A session at the end, which I will moderate. And we have prepared a Menti for people to respond to. The Menti will be placed into the comments section in the chat function, so have a look. And the key question is, what are 2 or 3 most important things that youth workers need to better support rural young people in achieving healthy relationships and good sexual health? So issues of the importance of sexual health, respectful relationships and consent have been highlighted in the media this year, often for all the wrong reasons. This session, as a result of that, I think is very timely. YACVic works to support improving access to information and services on sexual health and relationship to all Victorian young people, and also to strengthen the rural workforce to be able to work with young people on all issues that impact and influence their sex, sexuality, relationships, and health. But in particular, we focus on rural and regional young people, as they often experience a range of unique and different barriers to that of their metro counterparts, most notably with access to services and support related to sex, sexual health and relationships. Following on from our very successful Sexy and Safe project, which explored sexual health and education needs of young people in the Southern Mallee, YACVic have been partnering with the Centre for Excellence in Rural Sexual Health, also known as SERSH, with the Shout Working Group. The working group brings together rural and regional workers and sexual health workers across Victoria in a community of practice to support the development of resources and good practice to undertake this work. The group meets every 6 weeks on Zoom, and details for that can be provided to you if you need them. We meet on Zoom because we know that's the best way to connect workers. And we were doing that 6 months before the pandemic started. So maybe it was the Shout network that actually was a bit of a provider for the youth sector to finally start to move online. If you have any questions throughout the session, I would encourage you to put it into the chat. And if when we're doing the Q&A, you wish to ask your question in person, please use the raise hand function, and one of our moderators will make sure that we're able to access your screen and pin you. So let's get on with the session. Our first speaker for this session is Ange Davidson. Ange is currently a sexual health nurse at Clinic 35, Gateway Community Health. Ange has a background in nursing and social work, but also wants to be a florist. Ange has worked in a variety of workplaces, hospitals, community organisations and not-for-profits, schools and businesses across rural, regional and metro locations. Ange says that young people challenge her to do better. They make her smile and laugh and also make her frustrated, but teach her many, many great things. Over to you, Ange.
Thanks, Derm, for the introduction. Before I begin, I would like to acknowledge that this session is taking place on Wiradjuri country, and I pay my respects to elders past and present and to all Aboriginal and Torres Strait Islander people here today. Sovereignty for these lands was never ceded, and there is no justice without First Nations justice. This always was and always will be Aboriginal land. Hello, everyone. I am Ange Davidson, as Derm said. She, her pronouns. I am a sexual health nurse at Clinic 35, which is a sexual health clinic at Gateway Health in Wodonga, regional rural town that sits on the Victoria-New South border on the Vic side. For those who can't see me today, I am wearing glasses, I have a fringe, I have brown blondish hair with a bit of grey, and I'm wearing a really flowery jumper because I do like flowers. How do we take a strengths-based holistic approach to support young people to enjoy equitable, respectful and safe relationships? This is a big, broad question, and I want to acknowledge that there will be an enormous wealth of experience and skills in this virtual room. And I don't have the answers to this big question. But what I do have is my own experience of working with young people in the sexual health space and as a social worker as well. And I just want to share with you what I feel are some of the important learnings and observations for all of us, and in particular in rural and regional Victoria or across Australia, to be able to help young people and to help answer this big, broad question. People make decisions. Adults do, young people do, all people do. And we make them with the skills and knowledge and our own lived experience that we have. So we make those decisions with all those experiences that we have at the time of making them. And we don't necessarily think that when we're making our decisions that they're wrong or questionable decisions. They're the right ones they were making at the time. But often other people and often adults think that young people are making questionable decisions or decisions that there could be better decisions. However, just because we think young people are making questionable decisions about their relationships or their sexual health or their sexual life doesn't mean that they're less entitled to access good support, conversations, information about relationships and sexual health. I'm guilty of, in my head, thinking that young people could be making better decisions about relationships and sexual health. A couple of examples of this are, in particular during COVID and lockdowns, young people were coming to our clinic to get sexual health testing, and we asked questions about the numbers of partners that they've had. And we ask about numbers of partners in the last 3 months, numbers of partners in the last 12 months, part of sort of our sexual health history taking. And some young people are going, oh, I've had 20 partners in the last 3 months, which is completely fine, hopefully safe and respectful relationships and hookups that they're having. But in my head, I was going, how can we be having 20 partners in the last 3 months when we're in lockdown? So I'm questioning their decision-making in my head. But what came out of my mouth was something really different. And it was just an open conversation about what is hard for them in lockdown. You know, as a health practitioner, I know that lockdowns stop us moving the virus, but it was really important to just explore the difficulties of lockdown for young people and to also still allow them to access good sexual health, even though I was kind of going, just stay at home, have sex with the people in your own house if you can. And another example is young people coming to get tested, they test positive for chlamydia, they see them again in 3 months, they're positive again for chlamydia, and they're back again in another 3 months. And it's kind of in my head, I'm going, why aren't you using condoms or barrier protection? And I wish you were making better decisions. But I think in saying this, I think what's really important is to not give young people a hard time about their decisions or to put your own values onto them. So obviously when significant harm or safety of young people is impacted, we have a duty of care to act. But if we want to take a strengths-based holistic approach to support young people to have more equitable, safe and respectful relationships, I think a really key thing that's important for all of us working in this space, whether you're directly working with young people as I do in sort of a sexual health clinic, or with just working with young people generally, that it's important for us to do some self-reflection and take time to understand what our own values are and our own beliefs are in these areas. To be aware of your own preferences, your own beliefs, expectations, to learn to recognise them when you are working with young people. What decisions do you want young people to make? What decisions do you consider foolish decisions? They're all things that I think all of us need to reflect on and be aware of. Be aware of situations or decisions that you might find difficult. Talking about consent can be tricky at times because it is layered and it has many levels and it's layered. And Jenny will touch a bit more on consent in her presentation. Whether we're talking to young people about pleasure, about negotiating sex, about the use or non-use of barrier protection, condoms, dental dams, exploring sexuality, exploring gender, exploring when sexual assault has occurred, talking about breaking up. These are some things that really can present us with some tricky conversations and some difficult things. So it's really important, I think, that we all check our own beliefs and values around that. Young people, they're the expert in their lives. They're with the knowledge and skills and lived experience that they have acquired to date. But like all people, they need to be able to share their experiences and to gain new knowledge and skills. And with new knowledge and skills, decisions change over time. It's our job to continue to check our own values and situations we find difficult, to listen, to develop the capacity to be silent, to listen with an out an agenda. And I think everyone here today knows that, but this, as someone who's worked in the sexual health space, I I don't get it right all the time. And it's really important that I reflect on, and we all reflect on when we don't get it right and what was going on for that. Be curious, be interested in their experiences. Don't have an agenda or an investment in the outcome, but just ask them, and ask them before they're coming to you and telling you. Ask them, how did they come to their beliefs about respectful relationships? What do they think about consent? What are the issues? What are the things they're concerned about? What are the things they're struggling with? Ask about safety, ask about pleasure, invite their thoughts and what that means for them. What are their thoughts and feelings that come with that? Validate those feelings for them. Validate the feelings that you see and hear them talking about. People will have different meanings for consent. They'll have different meanings for respectful relationship. Legal and ethical frameworks can really help us explore relationships and safety with young people. And it's important to know the legal context that we operate in. And I think Jenny's going to touch a bit more on the ethical and legal framework. And if she doesn't, we'll talk about it in questions. Explore what supports young people have and which ones are lacking for them. As someone who works with young people, you don't need to have all the answers in sexual health and sexuality and respectful relationships and consent. But it's our role to create a space that explore thoughts and feelings. The other thing, I think, especially in regional rural context, is build their sexual health and sexuality literacy. Help them build those skills to seek out information from trusted sources. This is a bit more of a, I suppose, a clinical context of when you live in a regional rural area when there is one GP in town. How do you help young people access good sexual health? And GPs are busy places. They don't have the luxury to go and have a coffee for an hour without being paid for it. They operate on Medicare billings and they're complex. So my suggestion to people that work with young people is book yourself an appointment if you can. Get your organisation to pay for it, and you go and suss out the people that will be providing sexual health care for young people in your area. Suss them out around how do they feel about gender diverse young people? How do they feel about young people with disabilities? Ask them, suss them out. And if you can't, ring their practice manager. The other thing is that I want to just quickly add is telehealth. We have telehealth goes till December. Ask about telehealth, it's available. Help them build their literacy, help them make phone calls or let them hear you book an appointment for them. And the other thing is don't shy away from awkward conversations. Be curious, be open, and acknowledge that these things are hard to talk about. Thanks.
You're amazing, Ange.
Thank you. Yeah.
Thanks, Ange. That was fantastic. So much in there. And it's so important for youth workers to make connection with local sexual health services and get an insight into the sort of work that you do, that you're experiencing. And it was really refreshing to hear you sort of talk about that inner dialogue that happens, but that we don't share or judge people, that we validate them and we strengthen their ability. So I'm sure that's going to probably drive a couple of questions in the Q&A, but we might move on to our next speaker. Our next speaker for the session is Jenny Walsh. And Jenny has created some of the, my notes have just disappeared on me here, Jenny. Jenny has created some of the most talked about and well-read resources in the area of sexual health. Jenny has been responsible for the development of the Practical Guide to Love, Sex and Relationships for years 7 to 10, and Talk Soon, Talk Often, a guide for parents. She's currently on the expert advisory group for the National Curriculum on Consent Education, and she's holding up some of those resources in case people want to see what they look like. She uses health promotion, and I would say props, education and community development theories to change and to design and deliver heartfelt, people-centred and inclusive projects. Thanks, Jenny, over to you.
Thank you, Derm, and thank you, Ange. I've been lucky enough to work with both of you for many years now, and it's part of the joy of my work. Everyone, thank you for having me, and I am coming to you today from the land of the Wurundjeri people in the Kulin Nation, and I pay my respects to them and their culture. And I've had the pleasure in the last few years of working with VicSRC, and we have actually been making together a parent guide with the Aboriginal communities of Ballarat and Albury Wodonga. So that's going to come out, and it'll be free, of course, in November. That was awesome, because what that meant was going into communities and listening to what Aboriginal communities valued and wanted for their children, and they had lots of funny stories and lots of beautiful examples of how whole communities support their young folk. And yeah, it was a real honour. So what I want to, I also want to, so let's start, right. Oh, now the other thing I wanted to say to you was I put it in the chat as well. And I just want to acknowledge that there's a lot of folk who have had, you know, less than positive experiences of sex. And I know that you're here. Thank you for being here. And if there's anything that comes up today, I've put in the chat the number of 1-800-RESPECT and Lifeline as well. So that can be good if you've got no one else to go to today, you know, if you just feel like you need someone to hear you. And I also want to say that when we're working with young people who've had those experiences, that it's really important to remember that they can look forward to positive experiences in the future. And some of the young people I've spoken to over the years have said, look, I was abused as a child, and for that reason, no one gives me sex ed, because they're really worried about me. They're really worried about triggering something. But I want to know how healthy sex should be. I want to know how healthy relationships should be. So somewhere in there, there's a happy place, right, of kind of giving that information, or at least asking if it's wanted, or giving clues. And anyway, let's rip into it. Look, this year we've had, as Derm's mentioned, and a lot of talk about sexual assault in the media. And I just want to point out that the people that brought it to our attention were all young people. They were young women. Chanel Contos with her Insta survey, Brittany Higgins at Parliament, and Grace Tame, Australian of the Year. They have, you know, there's a lot of us that have been working in this space for many, many years, and those young women have just shoved it on the table, and I'm really grateful to them. And we find ourselves in a place where, hey, I've been invited to go and advise on the Australian curriculum to make sure that issues around consent get put on the agenda, and it's a different place than we've ever been before. So shout out to them. Now, sex ed is a human right, and more young people of all genders have joined together to call for their right to good sex ed. And for those of us in the sex ed space, it's no surprise, right? And the research has been telling us that young people, particularly those who are LGBTIQ+, are frequently left out of the sex ed, and that has a huge impact on their mental health. And so I'm really excited about the place of youth work in adding another dimension to this conversation for young people. We know sex ed makes an enormous difference in terms of health. There's so much research about it now. It's one of the best research kind of health kind of things out, right? But I won't go into that now, except to say that one thing that we have learned in recent years, say in the last 10 years, is when we challenge restrictive gender norms as part of sexual health education, it's actually more effective in promoting a person's capacity to act on taking care of themselves and within their relationships. So even if I'm giving information, say, about contraception, my sense, say, of being a young woman who's sexually active, and my right to be sexually active is part of my power to go in and get the health I need. So the way we talk about sex is all tied up with the big picture stuff. And again, that's why youth work is so kind of good at that, because that's the kind of framework, social justice framework, that you work in. I'd also say that access to services and relevant education is also impacted by other diversities, particularly cultural diversity and disabilities. So yet many large-scale resources that I've been engaged to do, I'm paid to design for general population, right? So there's more work to be done in terms of supporting young people on the fringes, so to speak. So now I want to turn to the challenges specific to young people living in rural areas. One of the things is, Ange already talked about GPs, but they, in research conducted in rural areas, in WA, GPs there said that they were reluctant to raise the subject of sexual health because they were worried about embarrassing their patients, or they felt that they were under-resourced or underqualified. I know with teachers as well, they feel scared about raising issues of consent because, again, they don't want to trigger a kid, or I beg your pardon, a young person, or they are concerned about opening up the box for something that they don't feel equipped to manage, particularly around sexual assault. Also, there may be limited choice in who a person can go to. Say, for example, if a young person would like to see someone of the same gender. The other issue is around students who might be reluctant to go to a teacher that they also play basketball with that night. The other issue for young people in the country is around, they're really worried about maintaining their privacy. They do not assume that their confidentiality will be maintained. And I know that they worry about that too in relation to, say, talking to a student welfare officer as well. So it's really important for those of us in those roles to say that we maintain their confidentiality. And of course, getting timely healthcare when you're young, have a limited income and very little public transport is difficult too. The other thing we know from the research is that in Victoria, sex ed is decided school by school. So that means there's a lot of variation in how much time is spent and which topics are covered. Now, a lot of schools are signed up to the Respectful Relationships program, which is covering, is tackling gender-based violence, but it's quite limited in terms of its capacity to support teachers in how to talk about.
So sorry, Jenny, so sorry. We're going to have to finish up this little bit right now. We've still got a few speakers to get through. Sorry.
Am I already 10 minutes?
You are.
Okay, I'm so sorry.
It's okay.
No, I just one thing I want to say then, and it's this, that youth workers are, you need training to know how to talk about these issues with young people in positive ways. Your work is super important, and it is not about being sex ed experts. It's about the relationship you establish with the young person and knowing what your boundaries are in relation to that, and training covers that. That's all. Thank you.
Thanks, Jenny. And doesn't time fly when you're talking sex and all things about consent and relationships? Thank you so much. There's a lot in there, and I'm so grateful that you gave that acknowledgement to young women in particular, stepping forward and putting these issues on the table, because it is really important, and also to reinforce the importance of workers making sure that they are up to date and getting training. And we've put a link in the chat to the Shout network. It's a great place to find out what's going on and for workers to get upskilled a little bit more. Thanks again, Jenny. Our next speaker is Kyle Hayes. Kyle, growing up in Victoria, developed a passion for reducing stigma around mental health, including how this can impact healthy relationships, sex, and sexual health. He advocates for young people to talk more openly and feel comfortable asking for help. Kyle is currently working for a number of youth-focused organisations, including Origin, Digital, Batia, Little Dreamers, and Youth Live for Life. After reading that, I don't know how he found the time to fit us in, but here he is. Over to you, Kyle.
Thanks, Derm. Hey, everyone. I would also like to acknowledge the traditional owners of the land that I'm on today. It's also the Wurundjeri people of Kulin Nation, and pay my respects to their elders, past, present, and emerging. My name is Kyle. I use he, him pronouns. I'm going to talk a bit about my experiences with this topic. And it is going to include a brief moment where I talk about consent. So just want to give a trigger warning for that. And if anything that I do say triggers you, keep an eye out for those great resources that have already been posted in the chat as well. As Derm mentioned, I currently work a lot in mental health and youth mental health. And I often get to talk about, in mental health, even after all the hard work has been done in the area around positive promotion and stigma reduction, it still isn't as openly spoken about or normalized as I think it should be. It's still a bit of a taboo topic for a lot of people. I have a bit of experience talking about some of these tougher topics like mental health, and I always like to come at those hard conversations through a lens of lived experience. Not an expert in anything except living this one life that I've been lucky enough to have. I recognize that as a heterosexual cis male, not everyone can or will relate to my experiences, but I think that's okay. I talk a lot about the idea of permission when it comes to storytelling, that hopefully by sharing some of my stories allows you to feel like you might have permission or the courage to share yours as well. And through that, we can open up and have some of those important conversations that we don't often get to have. Sex and sexual health has long been this uncomfortable topic for people to speak openly and honestly about. We get taught a little bit about puberty and contraception, and then I feel like the rest we just kind of have to figure out for ourselves. But asking questions about anything sex related kind of makes people uncomfortable, whether we're the ones asking or the ones being asked. And what do we do when we're uncomfortable? We either avoid the topic or we just kind of try to laugh through that awkwardness and that uncomfortableness. I think I spent so much of my time growing up laughing with my mates about sex and porn and erections. Even now, I just said erections to a group of strangers and I can already feel myself blushing and trying not to laugh. A few years ago, I discovered this passion for masculinity and men's health, and started to really piece together the impact that growing up in a rural area where masculinity and being seen as man enough were so important, and this has continued to have impact on me throughout my life. While I was reflecting on this topic, preparing for today, I started to remember a lot of moments where the ideals of striving to what I thought were what it meant to be a man really shaped how I viewed sex and relationships. How my friends and I spoke about sex and relationships with each other was problematic. It's what has started to commonly be referred to as locker room talk, and this idea of how young men especially are meant to view relationships, not just romantic and sexual relationships, but even their relationships with each other and their relationships with themselves can be quite toxic at times. The idea that my self-worth was somehow measured by my relationships with girls, whether that was in relationships or hooking up or, God forbid, being put in the friend zone by a girl, seems so ridiculous in hindsight, but something that I struggled with for so many years. The friendships I had with my male peers growing up, and I call them friendships for lack of a better term, were all built around this competitive system, constantly trying to be, as manly as we could be. However we chose to measure that at any given time, whether it was about sex or how far through puberty we were and who had the most grown out facial hair, we were constantly battling and policing each other, tearing each other down in this desperate way that, we wouldn't be seen as the least manly in our group. I don't think I've ever had a serious conversation about sex or sexual health with anybody. I remember it became this funny thing to go down to the local community health center and ask for condoms, and then we'd blow them up like balloons or fill them with water and throw them at each other. Sex and sexual health weren't openly spoken about, so we dealt with it with our confusion and our self-doubts the only way we could at the time, through overcompensation and immature humor. Even now, it's easier for me to make jokes about saying the word erection than it is for me to have an open and vulnerable conversation about The fact that I didn't feel emotionally ready the first time I had sex, that I did it because I didn't think consent was something that I needed to give. The limited conversations I had about consent and feeling okay to say no were presented in a heteronormative binary way that were framed that as a male, I was the only one who asked for consent, not gave it. I think we need to start having those awkward conversations about sex. We need to be willing and ready to answer the tough questions, to feel confident to talk to young people about erections and sex and porn and consent and sexuality and gender and all those topics that for so long have been put in the too awkward basket. We need to stop barely scratching the surface of a topic that's incredibly complex and nuanced and requires more than a few conversations about pubic hair and putting a condom on a banana. We need to stop referring to it as the talk or the birds and the bees, like sex is some Voldemort-like being that we can't refer to by name. We need to start being comfortable in being uncomfortable. Thank you.
Oh, Kyle, I'm so sorry. I feel like I'm jumping all over people. Back to Derm.
Okay, thanks, Kyle. Time does go fast. That was fantastic. One of the things I loved about what you said there was that you're the expert in your own life, which is what we want for all young people. So thank you for sharing that. Beautiful insights. Our next speaker is Sienna Gladstone. Sienna is currently a student at Warrnambool Secondary College and a student executive member of the Victorian Student Representative Council. She's passionate about young people having access to better sex education in schools and longs for the day that young people will have a much better place and role models in society to look up to, particularly in the areas of consent, mental health, and education in general. Over to you, Sienna.
Awesome, thank you for that one. Before I get started, I would just like to acknowledge and pay my respects to the land that I'm on, which is the Gunditjmara land of the Peek-a-Wrong people. So my name's Sienna, I use she, her pronouns, and I'm a regional student in Southwest Victoria. So I am currently on the Student Executive Advisory Committee for VicSRC, as well as the Warrnambool City Youth Council. And something that's talked about constantly and always brought up, and it's never put to rest at the moment, is mental health. And unfortunately, we've come to the devastating realization. The students at VicSRC have now declared it a mental health crisis that the young people of Victoria are going through at the moment, which is absolutely devastating. And I think when you look at it, mental health correlates with every single aspect of your life, you know, whether it's positive mental health, whether it's something that's going to negatively impact that, whether that's mental illness. And I think that needs to be talked about because one of the main component factors, you know, as deduced by surveys that I've conducted at my school and through VicSRC, is that consent education and sex education plays a huge factor in our own mental health and our own individuality. As it's been previously mentioned, and I'm sure you would all be so well aware, no one wants to talk about sex. No one wants to talk about consent. And we understand that's because, you know, it makes you uncomfortable. You might not feel safe talking about that. You might not feel safe in that environment. And I think, you know, if we're teaching this in class, it needs to be taught as a discussion, not as a lesson. You know, the educators, they are there to tell us, you know, what goes where, who does what, but it's different for everyone. And if we approach that as a discussion, rather than we have to listen to them, that's what we have to do, we can talk about it more. You know, if it's in a class setting, instead of just telling them, this is what we're learning, this is how we're doing it, have that discussion. Allow questions. Don't go, oh, wait to the end. Let them ask that question because they might forget it. Or the more you go on, the more they might not feel comfortable asking that. And something else that's really absolutely and crucial to include in those classes and just in your everyday conversations and talking is pronouns and inclusive language. So if we're using examples in school and we're using examples in the classroom about literally anything, making sure we're not just using heterosexual relationships. It's not a, he had sex with her, this is what you do if you're a male and you're going to have sex with a female. Using they, them pronouns, using examples of, non-heterosexual relationships and gay relationships, because those are okay to talk about. Because if we're learning stuff that isn't appropriated to us, that isn't, aligned with our experiences, we're not going to feel like this applies to us. We're not going to want to listen, and we're not going to understand. Because why would we learn something that doesn't apply to us, that might never apply to us? It doesn't make sense. So if we can have those conversations about not only sex education and consent, but about sexuality and individuality itself, that's how we're going to get through this. Because there's nothing worse than being part of a conversation that's directed at you and not with you. And we can't learn if it's a single person talking about something by themselves. And as it was mentioned before, I think young people are the experts in their own lives. And just listening to Jenny, what she was saying before, thank you for correcting yourself when you called us kids, because, we're young people. The teachers and the adults that I've come across, they think that we're kids. They think that we're immature. And, some questions that have been, they don't want to answer it because it's uncomfortable. And we totally get that. But we are literally young people. We want to learn. And one day we're going to be the same age you guys are, and we don't understand things, everything's going to go wrong and everything's going to be confusing, and we all need to be the best version of ourselves. If someone asks you, a question that you don't feel comfortable speaking about, that's okay. And I think if you want to say no and you personally don't feel like answering that, you can say no, because saying no empowers other people to say no. Saying no is a sign of respect for yourself and for others. And if you say no to answering that question, don't just shut it down. Don't go, no, we're not talking about that right now. Or no, I don't know the answer. Instead, offer them, something else that you can help them with. Go, hey, I actually don't know that. But how about I give you some resources where you can access that information? Or how about we Google that together? Or how about we have a class discussion about that right now? Because not everyone that you have to go to for information on these things has to be a teacher. It could be someone you're comfortable with. It could be a parent. It could be a different teacher who's not a sex education teacher. It could be your well-being staff. I know at my school, my well-being staff and my school nurse are the loveliest people. And if I have questions, I go to them. I'm a very inquisitive person and I ask a lot of questions, and I can see when my teachers get uncomfortable, because as Carl said, we have to start learning to be uncomfortable. We have to start learning to be comfortable with the uncomfortable. And if I can just leave you guys with one thing, I think it's so absolutely crucial and important to note that consent is another word for permission. You're going to ask someone for permission to do something, whatever you're doing. If you want to have a drink in the drink bottle, if you want to give them a high five, you go, hey, can I have a high five? Hey, can I have a drink? So if we want to get through the taboo topic of education and sex education together, we have to start coming at it as a community approach, because consent will always take 2 or more people saying yes.
Thank you, Sienna. That was fantastic. I'd probably want to open the next question up, I guess, and at the risk of annoying the moderators, I'm going to swap a question around just to pick up on those, the themes of consent, which have been coming in. And I think the question is largely around how do you say no? When do you say no? And what does that mean, particularly Kyle for you, but others as well, on the concept of masculinity? Who wants to go first?
I'll jump
Kyle.
in then and go with the masculinity side of things. I think from my experiences and, the experience that I was talking about, it was, I guess, difficult to think that permission was something that I had to worry about for myself. And it wasn't coming from the person that I was with, but more of a societal view that I guess as traditional men, we're not supposed to turn down sex, and sex is something that we're always supposed to be striving for and getting. And it was, I think, in the back of my mind playing of, if I turned down this, what would my friends say? What would they say? What would their reactions be to me at that age turning down sex and turning down sex as a male? So it was, yeah, it was a struggle, like, I think to find the word no, not because of the person that I was with, but I guess that societal view of how we look at sex and how we look at males when it comes to sex as well.
Sienna and then Jenny.
Sorry, would you mind just asking that question again? I think my laptop glitched a bit.
That's okay. How do we say no? When do we say no? And what does that mean for masculinity?
Right, awesome. Thank you. That's a really good question. So I think something that a lot of people always second guess themselves on or they don't do is trusting your instinct. If you're in a conversation or if you're in a setting or you're with someone and they say something and just you get that slightest bit, that slightest sense where you don't feel comfortable anymore or you don't want to do that or you don't want to talk about it, being respectful, just looking at them and going, hey, no, this is not what I feel comfortable doing. And it's something else that is really key to remember, because I do this so often, is you don't have to explain yourself. You don't owe anyone an explanation. You don't have to give them a reason. You can just say, no, I don't want to talk about this. Or no, thanks, let's move on to another topic. Or remove yourself from that situation if it's safe for you to do so. And, I think that does affect masculinity a lot, as Kyle was saying. I have a younger brother, and so I hear everything that goes on with all of his friends. I get all of that information, and it's a lot. It's kind of crazy to hear the things that young people and young boys talk about. It's quite confronting as well. And just I notice a lot of them not keen to go, no, I don't want to talk to her, because they're being pressured by their mates. And as Kyle said, it kind of helps with your status, because at my school and at all the schools I've been to, the most popular guys are the guys who get the most girls or in the most relationships. And that's based on popularity, which definitely needs to be improved.
So can you hear me? Good. I'm tempted now to tell a story. I was talking with my friend Will Burns, who's a youth worker in Swan Hill the other day. And I had the pleasure of being a mentor. YACVic engaged me to be a mentor to he and Mia Revere because they had already been doing sex ed. Anyway, so I was just giving them research and some tools. He has been regularly seeing a group of Year 9 boys, and they asked him the question, and I asked his permission to tell this story to him. And they asked him, what would you do what about if you're having sex with your mate's mum? Now, here's the thing. He and I both laughed when we heard that question, and then he dealt with it beautifully. And this comes back to the capacity, having the tools to deal with stuff. The first thing he did was to go through the legal framework and to talk about ages. Now, guess what? What if that was actually illegal? It was legal, right? So the next framework that he used was around this. I'm going to show you quickly now. And it's kind of, Dan. Okay, so it's suggesting that there's more than just legal, illegal. It's about aiming for happy, safe, fun sex, right? And so those young boys would talk about, well, how do we get from consent up to that end? And that's when you start talking about paying attention to your partner. And this is the thing, like, it's also about sexual literacy, right? Like, young people don't get access to information about what makes sex good. And then the final framework was, I won't hold it up because you'll never see it, but it's around a sex ethics framework. And that's to talk about power in relationships. And so because at the start of that conversation, Will may not have known what the answer was in a sense, but he had a bunch of tools in his head to help him work with those young people. So as you said, Sienna, to discuss, not tell. And that was genius. Yeah.
Ange, I'm interested to know whether issues of consent and masculinity for that sake as well come up in the clinic environment, and how you make young people at ease with those issues.
Often those things come up because we're asking about people's sexual lives. We always, I suppose, explore things of topics of consent and masculinity when young people are wanting to share that with us. And I think in terms of the how do you say no, when do you say no, and what does that mean for masculinity, I think the really important thing is that discussion. It just comes back to asking about what are the difficulties in saying no? What are the things that make it hard? What are the things that you feel when you might have said yes, but you didn't really mean yes? What was, like, exploring kind of what was happening in that context and situation. And asking young people, in what situations have there, you know, when do they want to say no? Like, when have there been times when they go, I wanted to say no then? And you go, okay, well, how come that was that you wanted to say it in that situation, but not in that situation? And it is gathering a lived experience of what makes you feel good, what makes you feel not good. And that asking, I suppose, young men and young women and gender diverse people about, you know, what are the difficulties in saying yes or no to a certain partner, and how does that impact with their friends or with their peers? And so I think the important things, and everyone said it today, I think, is just that helping young people have that, build their own lived experience and add to their experience and information about, yeah, what makes them feel good, what doesn't, what are the tricky things, what are the things that stop them, so that there is just this exploration of that, and having them sort of say, well, in an ideal world, how do you want it to be? What do you want it to be?
Yeah.
How do you want it to be in giving consent, when to say no, when to say yes? So I think it just keeps coming back to that, exploring lived experience and how people want it to be, and what are the difficulties, and helping them explore ways to try it differently. Yeah.
Thank you. Questions are coming in thick and fast. So I'll ask all of you maybe just to give one key thing to this next question is, how can we educate parents, and I would say adults, on how to approach discussions of sex with their children and what a healthy relationship and healthy sex looks like? Jenny, you'd be the obvious place to start here, because I think, if from memory you've written and presented on this, so just can you limit it to one thing, and then we'll move on to Sienna, Kyle and Ange.
One really simple way is I want young people to know that sex is a journey, not a destination, in a sense. So once you've started playing with someone, you are playing together, and that doesn't, so just because we've played together doesn't mean I've promised this down the end. It just means I might change my mind at any time. And that's the thing that stops young people all the time from expressing a no, or I've changed my mind. They feel like they're committed.
Sienna?
Yeah, so I think almost like any adults or parents watching this, however you would have liked to have that discussion, however you would have liked to be told. And, you know, again, we totally understand if you guys aren't comfortable with that, because I'll admit, I'm 16 now. Probably this time 2 years ago, I would not be here. I would not want to be talking about this. Like, if someone mentioned sex, if someone was like, Sienna, I'm going to tell you this, I'd be like, please don't do that. Like, I wouldn't want to know. And I think if you guys are comfortable, that's great. But if you're uncomfortable and you still persevere to have that conversation with us, that's even better, because that shows us that being comfortable is okay. And that's awesome, because if we're uncomfortable, you're uncomfortable, we can validate each other's feelings, but we can still have that open conversation together, and we can learn.
I love that too. Like, I think it's about, you know, I think it's been spoken about a few times today as well, you know, providing that providing that comfortable space, that safe space for a young person to feel like they can ask the tough questions and ask those things that, you know, they might feel awkward asking, and just, yeah, validating those feelings of awkwardness and uncomfortableness, and, you know, being aware of our own personal, you know, experiences and biases and stuff as well. And, you know, being aware of our own lack of knowledge and being willing to go, hey, look, I don't know, let's go and figure it out and let's find out. And, you know, taking a young person to, you know, a GP or a nurse or, you know, somebody else, or, you know, helping them get some of that informed knowledge as well, I think is so, so important. And letting, yeah, our young people know that it's okay to ask the questions. And if we don't know the answer, we're going to help them find it.
And finally, Ange, before I move on.
Yeah, just quickly, I think sometimes we, when engaging with parents, it's important to kind of ask what was their experience of sexual health, sexual education like? And there's often a real lack of or nothing. And sometimes even going back further than that, well, what was it like in growing up in your family talking about these things? And often that's like, well, we didn't talk about it. We just didn't go there. So I think it's important to acknowledge the gap in that's what it was like for parents in when they were experiencing talking about sex or talking about relationships. And that it just keeps coming back to that discomfort of that's okay, that's with your experience, and helping parents to maintain just an open, honest conversation and a space for that to happen in, and acknowledge that it's uncomfortable, but to listen openly, and just try and seek understanding from their young people about what's going on in their world, I think is really key.
Can I just, there's something I so want people to know, and that is that there's so much research now that says that talking about sex with a young person builds trust and into a better relationship. That is found in different spaces now, between parents and children, between youth workers and young people. That's been done in McKillop's project, and between teachers and classroom as well. And it's something about, I reckon, is my theory, is it's something about daring to be vulnerable and to say to the young people, actually, I know this is really important and I may not have all the answers, but I think it's really important that we do it, and go from there.
There are so many more questions that we could have gone through, which we're not going to have time for. Questions about porn, questions about toxic feminism, as well as toxic masculinity. I know that Jenny is working on a research project and has put a link in the chat. I think the chat's going to be really rich for us because YACVic are working with SERSH on a guide that SERSH are developing called the Busy Workers Guide, which is all about sex, relationships, sexual health. And we'll be working with regional and rural communities across Victoria over the next 12 months to implement that resource. But we have run out of time. Thank you. And thank you to all of our speakers. I think they did a stunning job. Raise your hands and, you know, do a happy dance for Ange, Jenny, Kyle, and Sienna. And I will hand back to Brianna.
Thank you everyone for that. If you haven't done so already, could you get on the Menti and just put what are the 2-3 most important things youth workers need to better support royal young people to achieve healthy relationships and good sexual health. And then shortly I'll bring up get the results brought up to see what some people have said. I can't really pinpoint just a couple of things that were said, because this whole topic is a very important topic that a lot of people need to understand and be educated and everything like that on it. One of my favorite things that was said was when Sienna said, with consent is just like asking permission. You need to ask permission for everything. So sex and everything else like that is no different. And that is a very big important thing, whether you are male, female, or anything. You should always ask permission and have consent before going ahead. I would also like to say that we are about to have a 1 hour break. So in that time, please go get a glass of water, walk around, get away from the screen for a bit. If you are not wanting to do that, we do have the YACVic CEO jumping on about what more can YACVic do for Victorian youth workers, which is a very good thing, because YACVic is an amazing organisation that is willing to help in any way possible. They just need to know what they can do to help, which is why we're here, as part of the reasons why we're here today, to get answers and to understand. As you can see, the Menti results are up if you just want to have a quick little read. But otherwise, we will be back at 2:15 when we have the exciting session on technology and intervention in youth work with a special guest speaker from the Finland Centre of Excellence in Digital Youth Work. And thank you, everyone. And I would love to thank Derm and all our guest speakers for speaking today. I'm very educated and was a pleasure to listen to you all. Thank you so much, guys.